How are you coping around the impact of COVID?
I'm going to be honest with you, the first word is fear.
This is maybe the most challenging situation I ever faced. It's difficult. Managing a team of 8 people as well and trying to do our best to help the most vulnerable people is even it just is not easy.
The official information still says if you think you've got COVID symptoms, you should go to 111, not your GP.
It does say that, you're right, yes.
Yeah. And so I think that contributes to the idea that people feel that the GP service practices are shut.
Some people are saying they just prefer to stay at home instead of going to the hospital because they have that assumption if you go to the hospital, you will die, definitely.
Some of the stories are people, even with some who are on long-term, with chronic health conditions, and the conditions are getting exacerbated, they still don't want to access help because they're saying they'd rather die at home with family.
They perceive the higher rates amongst BME communities to be partly due to discrimination in the health service. They think that hospitals are neglecting their patients and that they're not feeding them properly. Therefore, there is a view that it's much better to die at home with your family around you looking after you than to go to hospital.
I think the greatest fear is the systemic inequality that exists. I don't even think the trust was fully there in the first place, because before we're aware of being underserved, we're aware of not trusting the system and the structure. The immediate thing is building trust in relationships.
Complicating is things people don't have anyone to talk and address their concerns. So the burden then falls on the community worker. And I know some of them are making about 40 to 50 calls a day and providing that kind of reassurance.
Often you find they're calling us and they just want to offload and talk, and because they can't get through to any emergency support. So it's really difficult at this time. We identified in Brent that there are quite a bit of services available, but the public don't know the contact numbers of the diverse services that are available, and so they're unable to access the support that they need, and they will call the agencies that they engage with or that they know about.
I think people we work with, significant number of them, they don't know how to use these online services. It's something very new to them. And this is why from our perspective as an organization, we just realized that IT and digital inclusion is the area we definitely need to focus on going forward, because anyone can learn.
The community organizations are dealing in the front line. We speak to them and they speak to the communities. They are coping well, but I think there is an area of what can we do to build their resilience. They are doing their best to support, and they have transitioned very, very quickly to providing online services at home. But I feel there is something that needs to be explored further. Community organizations, for example, they are supporting each other, but one of the things that we are trying to do is to understand how do we build their resilience and what do we need to support them.